Hi, I'm Dr. Whitney Young.
And I'm Dr. Kerri Fullerton. We're the naturopaths here at Rooted Naturopathic Clinic.
Yeah, today we're going to talk about kids when they get sick. When do you need to freak out and take them to the walk-in clinic, doctor, hospital? When not to freak out, keep them at home, and then give some suggestions on when you would see a naturopath like us and a few little tips.
So first off, getting sick is important. Your children should get sick. This is where they build their natural immunity so that when they're older, they're stronger.
If it's fast, so if quick fever comes on suddenly, so a sudden change in how they're doing, and if it's affecting their behavior, so if they're really lethargic.
Yeah, if their color changes a lot, if you walk home and, suddenly your child is sort of gray or just laying there uninterested in food, uninterested in TV or their favorite toys, those are good times to take them in. That's bigger than just a sniffle.
Mm-hmm. Mm-hmm.
When we don't need to freak out, though, is, there's that cough that comes on at night. They climb into bed and they cough for half an hour and then they go to sleep. And they sleep all night, they wake up in the morning and they cough for half an hour, they go to school. Generally speaking, those are viral infections that don't need that long wait at the doctor's office or at the emergency clinic.
Yeah, and there's lots we can do for simple coughs. You could make adding honey to tea, hot water.
Mm-hmm. My son doesn't like honey, so we would melt it down and then put it in one of those syringes that you use for the Advil and just shoot that in there. There was actually a recent study where they showed that the honey before bed was more effective than most cough syrups on the market.
Yeah, very cool.
Mm-hmm.
Just a tip, don't give it to kids under 1 year of age. So avoid that. And if you do have a child under 1 year of age, bring them on into the clinic. There are other things we can do that are safe for coughs, homeopathics, for instance.
And lots of children have large tonsils for a multitude of reasons that is a whole other video in and of itself. One of the things you can do is teach your child how to gargle, even with regular water. They think it's fun. They get to gargle, they get to blow bubbles, but that can keep those tonsils clean on a day-to-day basis and help prevent future infections.
Mm-hmm. Yeah, another quick little tip, if you notice your kid is starting to get sick, we like to do what we call the warming sock treatment. Right before bed, you're going to put on 2 pairs of socks. One is more thin cotton, so you're going to wet the sock, put those on, and then a dry wool sock over top of that, and then you go to bed. So overnight, their body is warming up those socks, and they'll be dry in the morning and pulling the cold and the congestion from their head. It's kind of a simple home thing you guys can do.
Mm-hmm. Very effective. And of course the rest, keep them home from school that little bit longer if you can swing it. Get them into bed earlier. Get them to just settle down and take care of themselves.
Mm. So as you can see, we love treating kids. If you want to bring your kids in, it's great to have them as a patient, and then you can avoid the wait times at the walk-in clinic. You can call, make an appointment that day, come in for a quick 15-minute for us to check them, see what's going on, and give some solutions you can do right away when you leave.
And if you come in and we take a look down their throat or in their ears and we think, you know what, this is probably bacterial, then you can go off to your doctor or to the waiting room.